And here at the County Health Department, our mission is to serve, protect, and promote a healthy community for all. And I often tell our staff that the most important words in that mission are the first and the last: serve all. That's a mission that we take very seriously here. Now, as you know, we have all been dealing with this opioid epidemic that has gripped our nation for almost a decade now. And that's an epidemic that has claimed far too many lives here in Kent County and across the country. Now, if you were to close your eyes and in your mind imagine what the faces of that epidemic look like, whatever those faces look like, you would be right. But you'd also be, correct, you'd also be incomplete, because this is an epidemic that has touched every corner of our community and every corner of our nation. And some of the most vulnerable in this epidemic are faces that you might not expect. They're the faces of young mothers and their babies. Through opioid abstinence disorder, through neonatal disorder and syndrome, these are challenges which have really harmed children in our nation and have made families really struggle to get off to the good start that they deserve to get off to. And we can do better. That's something we feel very strongly about. We can do better, but we can't do better by ourselves. And so it's very important that we have teammates. And so I'm very happy today to talk about some of our teammates and to have them talk about an improvement for our community. And we have in the room members from Blue Cross Blue Shield, who are amongst our best teammates in this effort to deal with this opioid crisis and to help the health of our young moms and their babies. And I'm also joined on either side this morning by two of our real champions for public health, Senator Winnie Brinks and Senator Peter McGregor, who have been partners of ours and have helped us from a variety of issues, from vaccine advocacy to protection of our groundwater resources, to fighting this opioid epidemic in our community. And so first I'd like to introduce Senator Winnie Brinks, and it's my honor, Senator Brinks, to share the stage with you.
Thank you, Adam. Thank you for inviting me here today. It is always a joy to be here with leaders in our community who make such a difference, and I'm really glad to be able to promote the My Recovery website. This website provides invaluable help to those in our community struggling with substance use disorder. If you are struggling and don't know where to turn, this is a first step for resources available to you in our neighborhood. I was so excited to hear about this expansion to help women who are pregnant and likely to become pregnant. As a mom myself, I know the pregnancy journey can be exciting and hopeful and challenging all at the same time. I can't imagine how difficult it would be while suffering from substance use disorder. This expansion will help meet people with the resources they need where they need them. This is a critical issue to address. According to MDHHS, between 2010 and 2017, the rate of infants discharged from hospitals with drug withdrawals increased by more than 50%. In Kent County, per the most recent data available, the number of opioid-related deaths in 2017 was 93, up from 70 in 2016. Between 1999 and 2015, the drug-induced mortality rate here increased nearly fourfold, from 4.2 per 100,000 to 16.2. This innovative change will lead to better care for women and for new babies. I would like to take a moment to applaud the innovation and the drive of the individuals in this room. They saw a need for pregnant women struggling with substance use disorder, and they found a solution and found a way to make it happen. Thank you on behalf of our community. Thank you especially to Blue Cross Blue Shield and the Blue Cross Foundation for your financial investment in our friends and in our neighbors. And as a reminder, the website is myrecovery.info, myrecovery.info, if you are in need. Thank you.
Thank you, Senator Brinks. Another champion for our community and for public health has been Senator Peter McGregor. And Senator Peter McGregor, thank you for your assistance as well.
Thank you for having me here today. I just want to say thank you to the department, to the health department, the local and the state. Blue Cross Blue Shield, Senator Brinks, this is what we need to do to fix some of our problems here, not only in our county and our state, with the crisis that we're going through. As chair of the Department of Health and Human Service Subcommittee, we see the results, and a lot of times it's very poor results of not doing anything in regards to the health care of the individuals in our state. So I want to, again, applaud Blue Cross and the partnership that we have on both sides of the aisle, the locals definitely, in coming up with very good services and education for those that are going through the struggle with substance use disorder, especially for the new mothers and those little ones that, it's our job as adults to make sure we take care of these little ones and make sure that they are healthy from day one. And it's programs like this and resources that we're providing through this website that are going to provide these services, needed services, to prevent those ongoing costs. And if we can do anything to prevent those ongoing costs, it's so key, and it's just the smart way to take care of the little ones that are so precious to all of us. So thank you again. I appreciate it. Thanks for your leadership. And I look forward to, as this is unfolded, doing more, because we can always do more, like you said, Doc. Thank you.
Thank you, Senator McGregor. As I mentioned, it takes a team, and it takes the support of organizations throughout our community to really make a difference to impact these most wicked, challenging problems facing public health. Now, as you can imagine, local health departments have their hands full with lots of things that you may be seeing in the news and lots of things that you don't ever hear about in the news because we're working on them on an everyday basis. When we do have challenges like this and we need some support, we need some help, it means an awful lot to us to have organizations like the Blue Cross Blue Shield Foundation of Michigan that can help us when we have a good idea, that they can provide some support and make those things happen. And so it's my great honor to introduce Audrey Harvey, the CEO and Executive Director of Blue Cross Blue Shield Foundation of Michigan.
Thank you. Thank you very much, Adam, and thank you, Senators, for your participation here today. On behalf of Blue Cross Blue Shield of Michigan and the Blue Cross Blue Shield of Michigan Foundation, I'm very, very happy to be here today. Today we're going to provide to the Kent County Health Department a $50,000 grant that will enhance the access to local treatment, support, and recovery, and education through the myinfo.com website. What I want you to know also is that our commitment to the health and to serve those of Michigan parallels those here of the Kent County Health Department. And this grant is part of 5 grants that were given across the state. That is something we put together called the Addressing Perinatal Opioid Use Disorder. And that collaborative consisted of the Michigan Health Department, the Michigan Department of Health and Human Services, Blue Cross, and the Blue Cross Foundation. And grants were provided not only here in Kent County, but also in Lansing, Bay City, Traverse City, up in Sault Ste. Marie. And we're very, very happy to be able to be here today. The fact that you'll be able to increase the care that's given to mothers with substance use disorder that are at 3 different stages, both prenatal, pregnancy, and postpartum, is of exceptional importance to us, that they receive the treatment that they need. I mean, we've already discussed the numbers, and I don't want to take any wind away, but the fact that we're seeing tremendous increases, not only in the substance use disorder across our community, but in those that are the most vulnerable. We were very, very fortunate to be able to partner with the state of Michigan perinatal collaboratives across the state and putting this grant together, and are very happy that this grant, to be clear, is being awarded through the Region 4 of that Perinatal Quality Collaborative for the state. This grant is very important to us at Blue Cross, in particular because we know the myriad of health problems that will happen with pregnant moms, not to mention the number of infants that are then going to be impacted. And what we want to be able to do is help people across the state identify new ways of addressing substance use disorder with moms and babies, and then hopefully these programs can be shared with other organizations across the state as well. So again, I say thank you, and to let you know that we are very pleased and proud to be part of the partnership and be here today, Adam.
Thank you.
Well, good morning, everyone. I am Dawn Shanafelt of the Michigan Department of Health and Human Services, the director of our Maternal Infant Health Division and Maternal Child Health Title V. On behalf of the Michigan Department of Health and Human Services, I would like to thank the West Michigan Perinatal Alliance, which is our perinatal quality collaborative in Region 4, the Kent County Health Department, Blue Cross and Blue Shield of Michigan, and the Blue Cross Foundation for their partnership and commitment to improving the health and well-being of mothers, babies, and families. As we unite, and that's an important word, in pursuit of our maternal and infant health vision of zero preventable deaths and zero health disparities, we must make every effort to assure the voices of families are heard in our decision-making process. The statewide regional perinatal quality collaboratives are innovative, community-tailored, data-driven, and an inclusive method of improving the health of our moms and babies in our state. Each regional perinatal quality collaborative is well-positioned to not only improve the lives of families residing in their regions, but as you've heard today, improving the lives of families statewide, from the Upper Peninsula to our most southern borders. As we are amid an opioid epidemic, our collaboratives, supported by the Michigan Department of Health and Human Services, have risen to the challenge of helping moms face with substance use. From addressing bias to linking moms to resources, the collaboratives, supported by Blue Cross and Blue Shield, can further their efforts and get us one step closer to eradicating this heart-wrenching epidemic and assisting more families in Michigan on their road to recovery. Thank you.
Thank you, Dawn. Thank you, Dawn. And finally, I would like to introduce Joanne Hoganson. Joanne is director of our Community Wellness Division here at the Kent County Health Department. And it's her team that has done so much working with young moms and babies through a number of our maternal infant health programs to help get our kids off to the best possible start and off to the best trajectory for success in life possible. And so, Joanne, I'd like to welcome you to the podium.
Good morning. As Adam said, I'm an employee of Kent County Health Department, but really today I would like to represent all those moms that are impacted by this grant and thank Blue Cross Blue Shield, who has stepped forward with $50,000 to help us to reach moms who are suffering with a substance use disorder. I'm a mom too, and I remember how complicated those months of pregnancy and those months when I had to take this beautiful little baby home and wasn't sure what to do about, all the things like dirty diapers and crying in the middle of the night and all of the exhaustion. Imagine doing that while you're also battling substance use disorder. These are women that need help. These are babies that need a healthy mom to take good care of them. And I am very appreciative for Blue Cross Blue Shield for allowing us to expand myrecovery.info, a webpage that we here at Kent County Health Department developed to help people that have substance use disorder to find resources, to reduce stigma, to educate them. And now we're able to specialize that webpage specifically for pregnant women, and to help those women at a very vulnerable time in their lives to find the resources that they need to get better and to be the mom that they really want to be. Just recently, a few weeks ago, I was talking to a young mom, and she actually had her child taken away from her by CPS because of substance use disorder. And she looked at me and she said, "I'm trying to get better because I want my baby back." And as I thought about those words, I just imagine that there are a lot of moms in Kent counties who want to be good moms, but they also struggle with substance use. And we want to connect them with the resources and help them be the moms that they so want to be. Thank you, Blue Cross Blue Shield, for this grant. And we really plan on putting it to excellent use and be part of the solution for so many moms and babies in Kent County.
Thank you, Joanne, and thank you, Audrey, and all our friends at the Blue Cross Blue Shield Foundation of Michigan. Also, thank you to our senators from here in Kent County, Senator McGregor, Senator Brinks. Your leadership and support is greatly appreciated in our work to protect our community. This is, again, an epidemic that requires all of us to work together. And I would encourage everyone to please make yourself familiar with the resources that we do have available. Please look at that website, myrecovery.info. That's myrecovery.info, and learn more about the resources that we have for opioid use disorder, and soon all the additional resources we'll have for this important issue of perinatal opioid disorder and neonatal abstinence syndrome. Thank you very much for coming today, and thank you for supporting public health. And we now have questions for any of our guests today. Okay. Very good. And here we go. We need a senator on the right and on the left. We have to have one of each.
Make sure you're, ooh, switch it up. Can have everybody look the same? All right, one more.
I want one big shot.
You can take it to the back. See what happens.
I'll sit out in the car and wait for it.
Very welcome. Very welcome.